Today we talk about a very cheap supplement that has shown great benefits for your health and that has been heavily attacked by the main regulatory agencies in recent years. In a few minutes you will discover how this substance can help you age better, can reduce mucus secretion, improve the integrity of your digestive system, remove heavy metals from your body, or even help you leave behind addictions like tobacco. It's N-acetylcysteine or N-acetylcysteine, so stay tuned to discover all its secrets. Pay close attention throughout the video because I will be asking numbered questions for you to answer below in the comments. In this way we will all learn much more than with a passive viewing of the video. What is N-acetylcysteine or N-acetylcysteine? N-acetylcysteine is a variant of an amino acid, the constituents of proteins. That amino acid is cysteine, that's why it's called N-acetylcysteine. Only this cysteine has a modification in its structure, it's acetylated, hence its name. The biochemical structure of this molecule makes it a great antioxidant and gives it the ability to improve a multitude of symptoms. N-acetylcysteine is not just a supplement, it's also a drug that we find in all hospitals, and as we'll see, it can save your life. Now you have to understand the main mechanism by which N-acetylcysteine helps your cells. There's a molecule that you need in order to live. It's glutathione. Glutathione is the most potent endogenous antioxidant, and its synthesis requires 3 amino acids: glutamic acid, glycine, and the most important, cysteine. Of the 3, the one that conditions the amount of glutathione your body can produce is cysteine, and this is where N-acetylcysteine acts, acting as a precursor for the synthesis of glutathione. Why do you need good levels of glutathione in your body? You can think of glutathione as a master antioxidant. An antioxidant is nothing more than a molecule that helps buffer excess oxidative stress in your body. And oxidative stress is nothing more than free radicals. Think of free radicals as hand grenades that explode in your cells, breaking down healthy structures like proteins, lipids, cell membranes, etc. What an antioxidant does is nullify or deactivate those hand grenades. Well, glutathione is a master antioxidant because it is responsible for the proper functioning of antioxidant enzymes such as superoxide dismutase, catalase, or the coenzyme nicotinamide adenine dinucleotide phosphate. We could say that if you don't have enough glutathione, your cells are more prone to oxidation, aging, and therefore to present problems and diseases prematurely. In an extreme but rare case, when cells run out of glutathione, they die due to a rapid imbalance between oxidative stress and antioxidant capacity. First question, what other endogenous antioxidant has a potency similar to glutathione and we produce at night? But if glutathione is so important and beneficial, why not just take glutathione directly? Sadly, glutathione is not absorbed directly by the body. When you take it, it gets deactivated in the digestive system. This is why glutathione supplements have almost no bioavailability. Don't waste money on glutathione supplements. It's also costlier than N-acetylcysteine. What we are left with, therefore, is to give precursors of glutathione so that it is your own body that synthesizes more glutathione. Before diving headfirst into its practical benefits, let's see why regulatory institutions have recently come down on N-acetylcysteine. Keep in mind that the Food and Drug Administration in 2020 banned the over-the-counter use of N-acetylcysteine because it considers it a drug and not a supplement. The main argument they gave is that it was first used as a drug and then as a supplement, so it should continue to be considered as a drug. It's something similar to what's happening with nicotinamide adenine dinucleotide precursors, like nicotinamide mononucleotide. The legislation in many countries is very vague about what is considered a supplement and what is considered a drug. For these reasons, you may not be able to access an N-acetylcysteine supplement in your country, despite it being one of the safest and most effective molecules for many conditions. In any case, in Europe, there is no problem accessing N-acetylcysteine, and you have it in most online and physical supplement providers. Now let's see how N-acetylcysteine can help you. N-acetylcysteine is the best mucolytic. You probably recognize N-acetylcysteine or acetylcysteine as an ingredient in the mucolytic medication your parents gave you when you had a cold as a child. Mucolytic means it breaks down mucus. Lysis means to break. It's a molecule that helps to break down the proteins in the mucus generated in the bronchi and respiratory tract, making it more fluid. A more fluid mucus is easier to expectorate and eliminate. Moreover, it's a mucus less likely to retain bacteria and other microorganisms. That's why it's sometimes also called mucokinetic. It helps to move the mucus, to mobilize it. Second question, who among you watching the video have taken N-acetylcysteine for this purpose? Mucus is not bad per se. and helps us eliminate harmful pathogens, but an excess of mucus, besides being a very annoying symptom, can facilitate respiratory infections. For the geeks out there, the mucolytic mechanism of N-acetylcysteine is based on the breakdown of disulfide bridges in the mucoproteins of bronchial secretion, as these disulfide bridges are responsible for maintaining the tertiary structure of the mucoproteins. We all produce mucus daily, but in some lung and respiratory diseases, an enormous amount of mucus is produced that greatly increases the risk of lung and respiratory infections. For example, it has uses in reducing exacerbations of chronic obstructive pulmonary disease, a disease that involves lung inflammation and excess respiratory secretions. It helps balance your body's antioxidant levels. As we said at the beginning, the main mission of glutathione is to capture free radicals of oxygen and nitrogen that damage your cells. What happens is that glutathione, after capturing a certain number of these molecules, degrades and needs to be regenerated. The limiting factor here is cysteine. And what we do with N-acetylcysteine is simply provide cysteine to regenerate the glutathione. In fact, the antioxidant effect of whey protein is precisely due to this. It provides good levels of cysteine and other antioxidant peptides. In summary, N-acetylcysteine recharges your cell's antioxidant batteries and makes you more resilient to oxidative stress. Acetaminophen or paracetamol poisoning? N-acetylcysteine has been used for over 40 years to save many people's lives. How, you might ask? Yes, people who get poisoned with paracetamol and are on the verge of having liver failure. Paracetamol is metabolized into a molecule called N-acetyl-P-benzoquinone imine, which is a very toxic metabolite for the liver as it rapidly decreases the levels of glutathione, an antioxidant that, as we have said, is super important for all cells, but mainly for liver cells. Without glutathione, liver cells die quickly, and this inevitably leads us to potentially fatal liver failure. This is where non-acetylcysteine can save your life, quickly restoring glutathione levels when given in high doses and intravenously. Third question, do you have any idea of the number of paracetamol poisonings that occur each year just in Spain? Strong anti-inflammatory action. There is a key molecule in the onset of inflammatory processes. It's the nuclear factor kappa beta, which initiates the inflammatory cascade. However, N-acetylcysteine inhibits this molecule, and that's why it is effective in disorders that involve inflammation, like all the ones we will see in this infographic. Exacerbated inflammation is an unequivocal characteristic of a multitude of disorders. This is another utility of N-acetylcysteine. Polycystic ovary syndrome. Polycystic ovary syndrome is a disorder that affects up to 10% of women of childbearing age and is characterized by menstrual disturbances, polycystic ovaries on ultrasound, and hormonal alterations such as an excess of androgens in women. Its consequences are many, varied, and we review them in this recent video. The benefit of N-acetylcysteine in women with polycystic ovary syndrome has been studied, and the conclusions are that it can improve the number of ovulatory cycles and therefore the fertility of women with this problem when compared to placebo. Therefore, it also seems to have some utility. Ulcerative colitis. Gastrointestinal diseases are very common, while therapeutic alternatives without side effects are still very scarce. Those who suffer from inflammatory bowel disease and other digestive disorders see helplessly how their quality of life is dramatically reduced. Well, N-acetylcysteine has been studied for its antioxidant role in gastrointestinal pathologies such as Helicobacter pylori infection or inflammatory bowel disease. Referring to the latter, patients with ulcerative colitis who receive N-acetylcysteine as an adjuvant improve the frequency and consistency of stools, the number of nocturnal stools, the presence of blood in the stools, fecal incontinence, abdominal pain, and the need for antidiarrheals, as this work shows us. This benefit is achieved by maintaining intestinal barrier integrity and exerting an anti-inflammatory effect on the intestinal epithelium. Question number 4. In addition to ulcerative colitis, what is the other disease that is classified within inflammatory bowel disease? Chelating effect of heavy metals. Due to its chemical structure, N-acetylcysteine can bind to heavy metals such as cadmium, mercury, and lead, forming complexes that are easily excreted. In this way, N-acetylcysteine would prevent or help treat the harmful accumulation of these metals in your body. Anti-addiction and anti-impulsivity effect. N-acetylcysteine has a curious proven effect regulating neurotransmitters in your nervous system. Remember that neurotransmitters are small molecules that act as chemical messengers in the brain. One of them is glutamate, which is predominantly excitatory and is thought to be involved in the pathophysiology of disorders such as obsessive-compulsive disorder, impulsivity, and addictive behaviors in general. Also, in anxiety and stress, N-acetylcysteine decreases the concentrations of glutamate in the nerve synapse. In this curious study, N-acetylcysteine reduced brain levels of glutamate in cocaine-addicted patients that were basally elevated. The combined use of N-acetylcysteine with serotonin reuptake inhibitor antidepressants in disorders like obsessive-compulsive disorder is under evaluation. The response rate appears to increase when N-acetylcysteine is given with the usual medication. Similarly, in subjects who are quitting smoking, N-acetylcysteine can help achieve it. In this study, 2,400 milligrams of N-acetylcysteine for 4 weeks in nicotine addicts significantly reduced the frequency of cigarettes consumed after 2 weeks of supplementation. Athletic performance. Can N-acetylcysteine make you a better athlete? The truth is that for decades, athletes from many different disciplines have been taking N-acetylcysteine for a supposed benefit in performance. Although we have little evidence of its effectiveness in this regard, there is some very interesting study. In fact, in people with low levels of glutathione, N-acetylcysteine may have an anti-fatigue effect. This is interesting because most likely most antioxidants are only beneficial in individuals with low baseline levels of them. This study precisely analyzes that. They divide 100 individuals according to their baseline glutathione levels into high, low, and medium levels. Then they were supplemented with 1,200 milligrams of N-acetylcysteine per day for a month, or with a placebo. Finally, performance test and oxidative stress measurements were made. Well, the group with the lowest levels of glutathione improved their performance by up to 15%. However, those who had moderate and high levels of glutathione before starting the intervention did not improve at all. Hangover. Some studies show some effectiveness in reducing hangover symptoms, especially in women. Remember that the best thing you can do to avoid a hangover is not to drink alcohol. What is the correct dosage? For most uses and benefits, the dosage of N-acetylcysteine ranges between 600 and 1,200 milligrams daily. In any case, we're talking about a molecule that is safe for the vast majority and has shown nothing more than some digestive discomfort when taken in high doses. Remember, it's just an amino acid after all. In extremely high intravenous doses, something that only occurs in a hospital setting, and usually for paracetamol poisoning, anaphylactic reactions can occur in susceptible individuals, something that happens with almost any drug. Take it on an empty stomach for better absorption and bioavailability. As a precaution, N-acetylcysteine can reduce the excretion of some drugs such as pravastatin, valsartan, erythromycin, torsemide, lovastatin, digoxin, enalapril, or simvastatin. This would increase the plasma levels of these drugs, which is an interaction to be very aware of. Today you have learned some beneficial effects of N-acetylcysteine. Now I ask you, have you ever used N-acetylcysteine? What was your goal and what results did you get? We carefully read your comments as they can help many people. See you in the next video. Thank you very much for being there. A big hug and keep empowering.